Hello students, this is Professor Saika, and this is the Nclex question assignment review. Through this, I'm going to be going over the questions from that assignment and kind of talking through why the answers are what they are, and then, sorry, it's jiggling a little bit, the camera was, and then why I chose those answers, or why those answers are the correct answers. Give me just 1 second. Okay, so first one, we are going to be looking at number 1. Patient diagnosed with cancer has received several treatments of combination chemotherapy and has a WBC of 2.2 and a neutrophil count of 79. Which hemopoietic growth factor should the nurse administer? The answer is C. So part of why the answer is C is because they had wanted you to be able to calculate the ANC. I did have this in my PowerPoint for week 1. I do not expect you to know how to calculate an ANC for my exams. However, that is something that may come up on the Nclex. One of the things you want to know about this one is that you were looking for a hematopoietic growth factor. If you don't know what the other ones are, but you know what filgrastim is, then that's what you want to go with. Second question. With this question, you really want to focus in on what it's asking you. And so it's asking you for a wrong answer, specifically a medication. The answer for this one is going to be B. So with this question, how I looked at it is I like to go through the questions and do a yes, it does answer the question for the answer options, or no, it does not answer the question. So question, I apologize. Answer number A. Vitamin B12 to a patient diagnosed with pernicious anemia. I don't know what pernicious anemia is, but I know what anemia is, and that's when you have a low red blood cell count. B12 does kind of help with energy, so maybe, anemia, you have a low red blood cell count, you're more fatigued, maybe, so I'll keep that answer. Erythropoietin to a patient diagnosed with chronic lymphocytic leukemia. Well, I know that erythropoietin helps to stimulate the bone marrow. So that doesn't sound wrong. So I'll keep that one. Filgrastim to a patient diagnosed with a solid tumor. That sounds right. Heparin IV to a patient diagnosed with disseminated intravascular coagulation. With DIC, we know that that's a bleeding and a clotting oncological emergency. So that one's okay. So the only 2 that I have are the top 2. And remember, again, we're looking for a wrong answer. In this situation, B is the wrong answer because with chronic lymphocytic leukemia, that is a disorder, a cancer of the bone marrow, a cancer of the blood. So you don't want to stimulate the bone marrow for that one because it would then stimulate the cancer cells that are in the bone marrow. Which patient should the nurse question receiving erythropoietin? It's going to be the patient with essential hypertension. The reason it is essential hypertension is because that is contradicted and can sometimes be can sometimes cause uncontrolled hypertension. The nurse assesses excoriated skin around the colostomy stoma of a patient diagnosed with cancer of the colon. Which intervention should the nurse implement first? The answer to this one is going to be C. Gently cleanse the area with mild soap. So with this one, again, I would look at the question and it's asking for an intervention. So something that you would do to assist this patient. And it's asking what you would do first. So if a patient has a colostomy or a stoma, most of the time there's already going to be a consult in for an ostomy nurse. And that isn't necessarily a type of intervention you can do right now to help the patient. That's an intervention that you would then pass the buck So you don't want to pick that one. Apply a skin barrier protectant paste around the stoma. Yes, you would want to do that. But if you haven't cleaned the area first and there's any stool on the area, that barrier paste isn't going to work. So you would want to cleanse the area first. And the reason why you're not going to pick D is because you don't want the pouch to be, the wafer to be too far away from the stoma, because then that's going to leave an area for more skin to be excoriated by stool content. So you want the wafer of the stoma application to be as close to the stoma as possible. So then the best answer for this one's going to be C. The patient calls the nursing station and requests pain medicine. When the nurse enters the room with narcotic medication, the nurse finds the patient laughing and talking with visitors. Which intervention should the nurse implement? So again, this one is centered around pain. And for this question, we're talking about oncology patients. So I want you to remember that with oncology patients, pain is very difficult to control, and it's typically chronic. And with chronic pain, it can be very hard to control it, and it's going to end up with the patient living with the chronic pain for their whole life. So the correct answer with this one is A, administer the patient's prescribed pain medicine. So with that one, the reason why I would not pick B is because we don't know that this is a narcotic seeking behavior. We don't know that this is something that's been ongoing. You know, maybe this is the first time the patient has company visiting. So even though this patient's in pain, they're trying to have a good time. Wait until the visitors leave. What if the visitor's there for a while? You don't have to worry about the visitor taking the medication, because you're going to give it to the patient and you're going to watch the patient take the pain medicine. And then check the MAR to see if there's a non-narcotic medication ordered. A lot of times, patients with chronic pain will be using a non-narcotic alongside a narcotic type pain medicine. So we do want to keep the pain medicine on time and under control. So with this one, we would still give the patient their pain medicine. Which discharge instructions should the nurse provide for the patient diagnosed with cancer who is taking hydrocodone with acetaminophen, PRN for pain? Answer is D. So with this one, looking at the question, I would look for instructions in regards to pain medicine. That's really what this question is trying to ask you. Take the medication only when pain is severe. That is not always what PRN pain medicine is for. A lot of PRN pain medicine has a grading where if it's, like in the hospital, it'll say if your pain score is 6 to 10, take this one, versus if it's 1 to 6, take this one. The other thing with that is at home, we're talking about discharge instructions. So at home, the patient doesn't want to wait to the medication till the pain is severe, because the medication is going to take a little bit for it to work. Instead, we instruct them that if they have pain coming on, to take the pain medicine to try and keep the pain level from getting too severe. We do not want to encourage them to use additional acetaminophen for any pain unrelieved by the medication, because then you risk putting them into acetaminophen overdose. Notify the healthcare provider if the medication relieves the pain. That is something that you could encourage them to do at their next visit, but that is not something that you would need to make sure the patient knows on discharge. And then increase intake of fluids and roughage in a diet. That's because pain medicine, narcotics are going to slow down the GI tract, and we want to avoid this patient from getting constipated or an obstruction. The patient asks the nurse, does everyone who gets cancer die of it? The nurse's best response is based on the understanding that. So this question is looking for you to give some type of response to that statement. The answer is going to be A. About 5 million people in the U.S. survive cancer for 5 years or more. Even if you did not know, I apologize. I'm doing this on my phone to try and multitask. So even if you did not know if that was right or not, I would not want to pick B, because B sounds very definitive. It's saying all 1 million people will eventually die. You don't really want to pick any question that's an absolute, because as we know with nursing, everybody has their own baseline, or everybody reacts to different things their own way. So you're not going to have every single person, all of them reacting to the same thing. C is not correct, because cancer is not the leading cause. Heart disease is one of the leading causes of death in the U.S. I apologize. And then it destroys hope to discuss dying with a patient with cancer. That is not true. A lot of times patients understand better if you are openly discussing with them their expectations and their chance of survival at 5 years, and really just talking about dying in preparation, because we all, at some point, everyone will die. When planning the discharge of a patient with cancer, which of the following should the nurse include as a priority? So this, you're looking for the priority number one thing that you want to tell a cancer patient when they're getting discharged. The answer is going to be D. So the reason why the answer is D is because encouragement to drink no alcoholic beverages. Yes, you do want to encourage them to do that, but that's not going to be pertinent at discharge. That's not something that's going to impact their day-to-day life. Information on all local hospices, we're not going to do that because the patient might not be at that state yet. So they might be getting cancer treatment as a curative option. So that would be very out of left field and would probably bring up more questions than the patient would want. Plan for a visiting nurse. Not all patients that are being discharged for getting treatment for cancer need a visiting nurse. So that's not a priority that you would do that, because the patient might not need it. However, the priority would be information on stress reduction techniques, because most people that are diagnosed with cancer are going to have a lot of stress, anxiety, depression, apprehension. So it's always very important to stress to them how to de-stress. The patient with cancer states, my pain is a 10 on a scale of 0 to 10. Which of the following is the appropriate nursing intervention? So again, here you want to do an appropriate intervention and one that you can do. The answer here is going to be C. Assure that a strong opioid, non-opioid, and adjuvant are ordered and administered per order. So cancer pain is a very different type of pain than any other types of pain. These patients were typically not too concerned about them becoming addicted to them. They may develop a tolerance, but we don't really worry too much about them becoming addicted. B, ask the patient if the pain is really that bad, since narcotics will be given as a last resort for severe pain. That's really not true. And also, you don't want to ask them if it's, quote, really that bad, because then it not only does it sound rude, but it sounds like you don't believe them. And then that can impede patient and caregiver trust. And then administer another dose of Demerol, meperidine as prescribed. So that is, I apologize. So yes, so that is a type of narcotic. It's called Demerol. It's really not typically used for pain control anymore. In planning the care of a patient experiencing fatigue related to chemotherapy, which of the following is the most appropriate nursing intervention? So this question, you are looking at fatigue specifically. And then what is the type of intervention you would do to alleviate fatigue? The answer for this one is to prioritize and administer nursing care throughout the day. You do not want to do all of the care at once, because that will really drain the patient's energy. And we're thinking about a patient that is fatigued. You don't want to push them to do everything all at once, because that they're not going to be able to get it done. So that's why we're not going to do B. If you notice in B, it says accomplish all of the nursing skills. Again, that's that definitive, almost you're going to get every single thing done. So we're not going to pick that one. Perform all nursing care duties on the evening shift. We're not going to do that one either, because normally by the end of the day, the patient's going to be more exhausted. And then limit the number of visitors, promoting a maximum opportunity for sleep. That isn't going to help the patient feel less fatigue. Perhaps telling that the visitors they should leave at night would be better, but that is not the primary or the most appropriate. Most appropriate would be your care throughout the day, spreading it out. 6 days after receiving chemotherapy, the patient reports that my mouth feels like it's on fire. Which of the following is the priority nursing action? So with this one, the correct answer is C. So part of the reason why we picked C. So looking at this, 6 days after receiving chemotherapy, they're having this feeling that their mouth is on fire. So you want to think about what you know about chemotherapy, think about what side effects that could be, and why it's happening 6 days after. So we know that patients are going to hit their lowest in lab values between 6 to 10 days later. So we know that affects their mouth, their GI tract, their bones, as in their blood levels, and then their hair follicles can start to be affected. Encourage rinsing the mouth several times per day with an over-the-counter mouthwash. We are not going to pick that one because a lot of over-the-counter mouthwashes have alcohol in it, and that will dry their mouth out more. Administer pain medicine. That may be something that will be needed down the line, but the priority nursing action that you can do right now would be to help visualize what is going on in the mouth. You don't want to just give pain medicine because their mouth is on fire. You want to ask more questions about what does it feel like? When did it start? Visualize what's going on in there. And then instruct the patient to eat small, frequent meals, soft food such as applesauce. That is a good intervention for if they do have some type of thrush or stomatitis or mucositis going on. But you do want to make sure that you examine the mouth, because it could be thrush, which is a fungal infection, or it could be the skin breakdown where they have ulcers in their mouth, and you would treat those two different ways. So it's very important that when a patient comes to you with some type of complaint, that you are assessing what their complaint is directed at. The nurse finds the patient vomiting on the second day after chemotherapy. Antiemetics and IV fluid have been administered as ordered. The nurse should include which of the following as an appropriate intervention for this patient? Offer music therapy to decrease nausea. So this one is a little tricky, if I do say so myself. Looking through this, it's specifically asking what interventions you would do for this patient right now, specifically related to the vomiting. Encourage the patient to remain upright in an upright position after eating is correct, but not for 2 hours. I would say 30 minutes, 45 minutes would be enough. Obtain an order for a tube feeding to assist adequate nutrition. That is not an intervention that you can do right now to alleviate the vomiting. That would possibly be something you could do with a discussion with the provider, but this is only their second day of chemo. So they may not need tube feeding. They may just need more support controlling their nausea. And then discuss decreasing the next dose of chemotherapy with the physician. Again, this is only their second day, and we don't know if this is going to be a dose-limiting side effect. What that means is we don't know if their nausea is causing them to actively, well, it says patients vomiting, but we don't know that they're vomiting so much that they can't keep food down, that they're losing weight, that they're becoming dehydrated. If that were to happen, which would take a few more cycles and longer days, then we would talk about a dose reduction of chemotherapy. But right now, that's not in our field. That's not in what we would want to do. After receiving a permanent pacemaker, the patient asked the nurse if there are any activities to avoid during a vacation scheduled 4 months after discharge. Which of the following is the most appropriate response by the nurse? There are no restrictions. You should avoid working over a running engine, avoid microwaves, and swimming in the ocean should be avoided. The answer is B. So this question, what it's looking at is it's asking in reference to a pacemaker. Looking at the options, there are going to be a few restrictions, but not many. Swimming, I'm jumping down to D. Swimming, you would want to avoid in the first couple weeks, and that has to do with the motion of the arms. You don't want to be pulling on those sutures, pulling on where that pacemaker was just put in. You want to avoid being near high frequency waves, like high frequency waves. What I mean by that is you don't have to worry about microwaves unless they have an ancient microwave. Nowadays, microwave ovens are made a lot better. The answer would be working over a running engine, again, because they would be near those high voltage power waves, and we don't want that to impede the function of the pacemaker. The patient with a recent diagnosis of cardiomyopathy asked the nurse, "What contributed to my getting this illness?" The most appropriate response is to say that the majority of patients with cardiomyopathy also have an unknown cause. Also have is what it should say. Also have an unknown cause. So although cardiomyopathy could be caused by genetics, hypertension, viral load, most I apologize, I got distracted. Most causes are unknown, that cardiomyopathy just occurs. So that's what you would want to explain to them. You could then further explain, these could have impacted it, but more than likely, we're never going to be able to identify one specific cause. And lastly, the nurse should include which of the following in the plan of care of a patient after a pacemaker is inserted. So it's the plan specifically related to pacemaker placement. The correct answer is going to be A, instruct the patient to avoid lifting the arm on the pacemaker side above the shoulder. So with this one, we would not want to encourage the patient to exercise the shoulder until the incisions have healed. So we don't worry about pulling those incisions out, messing up the placement of the pacemaker. We do not want to wash the incision site until it is healed. And then instruct the patient to avoid the use of microwave ovens. This again talks about how newer microwave ovens really are not that contradicted anymore because they're not using those high power frequency waves. So that is all for this review. If you have any further questions or would like me to go over anything more in depth, please email me and let me know. Thank you. Have a good night.